All right, let's jump right in. Today we're tackling a really critical question. In this digital age, what actually happens to your most sensitive health information? We're going to trace the journey of our data and find out just how secure it really is.
I mean, really think about it for a second. Every single doctor's visit, every scan, every prescription, all of that creates a digital footprint. And all of that data has to live somewhere, right? So the question is, where is that somewhere? And maybe more importantly, who holds the key?
And that right there, that's the core of the issue. We're not talking about just a few files here and there. Healthcare organizations today are facing an absolute tidal wave of patient data. And the old way of doing things, just picture these clunky, humming servers in a hospital basement. It just can't keep up anymore, not even close.
So, this brings us to our first major challenge, the digital data deluge. We're going to explore exactly why those traditional on-site systems are basically buckling under the pressure of this massive data explosion, and what that really means for all of us as patients.
Okay, so if the old systems are failing, what's the modern solution? Well, for countless healthcare providers, the answer is moving to the cloud. It's a system that's actually designed from the ground up for the complex, urgent demands of modern medicine.
And when you put them side by side, the difference is pretty stark. Traditional data centers, they're super expensive, physically locked down, and honestly, they're vulnerable to data loss from something as simple as a power outage. But the healthcare cloud, it's way more cost-efficient. It lets doctors get secure access from anywhere, and it has built-in backups. That means care can continue no matter what.
But, and this is a big but, all that amazing convenience brings a massive challenge with it. And that leads us to the ultimate security question. See, there's a really delicate balance here. Whenever you put something so incredibly personal online, security has to be the absolute #1 priority, period. And this is the central question we have to answer. Now, it's one thing to make data easy to get to, it's a whole other ballgame to keep it safe from prying eyes. The stakes just couldn't be higher. A data breach can lead to huge legal penalties, sure, but even worse, it can cause a complete and devastating loss of patient trust.
So, how do we solve this? Well, you build a digital fortress. And in this final section, we're going to break down all the essential layers, both technology and trust, that are designed to protect our most private information from the ground up.
The first and most fundamental layer of this fortress is data encryption. The easiest way to think about it is like rewriting your medical results in a secret code that only you and your doctor can understand. So even if someone managed to intercept it, all they'd see is a bunch of unreadable gibberish. This protects your data both when it's being sent and when it's just sitting there, being stored.
But encryption is just the start. The next layer is all about strict access controls. That means using tools like multi-factor authentication, where you need your password and a code from your phone to make absolutely sure only authorized people can ever get in. Third, you've got regular security audits. Think of them like routine checkups to hunt for and fix any potential weak spots before they can be exploited. And finally, you need a robust disaster recovery plan so that even if the worst happens, that data can be restored safely and quickly.
But all the technology in the world doesn't really matter if there isn't trust. And in healthcare, that trust is built on a solid foundation of compliance, which is really just about following a strict set of rules designed to protect every single patient.
So here's a peek at the global rulebook. Standards like HIPAA here in the US, which is all about patient data privacy, or GDPR over in Europe, which centers on data protection rights, these aren't just suggestions. They are legally binding. They dictate exactly how patient data must be handled. So when a platform follows these standards, it's making a clear, real commitment to keeping your information private and secure.
So what does all this look like in the real world? Well, the most secure platforms combine all of these layers. They use things like military-grade 256-bit encryption, which is virtually unbreakable. They use smart AI systems that are always on, actively hunting for and neutralizing suspicious activity 24/7. Their entire structure is built around those HIPAA-aligned frameworks, and they keep backups in multiple different regions to guarantee that vital information is always available. This is the digital fortress in action.
Ultimately, it really all comes back to that one word, trust. Patients trust their doctors with their health, and a secure, compliant cloud platform is the modern tool we need to protect that sacred trust in our digital world.
And that leaves us with one final thought. In an era where our health is more and more digital, it's worth asking yourself, how strong is the fortress that's protecting your data?